of individuals in Baltimore County and in our other jurisdictions who aren't. We are now approaching 4,000 cases of confirmed COVID in Baltimore County. We're approaching over 170 folks who have succumbed, unfortunately, to this terrible disease. And we're also seeing, as we focus on the health crisis, we're seeing an economic crisis as well. Just thousands of residents who are scrambling to get uninsurance benefits, or small businesses who are struggling. So this is a tough time for everybody out there. And I want to just actually commend County Executive Ball and Glassman. They've been part of a great cohort where we are collaborating and working together to try to fill the gaps. I think crises sort of start and end at the local government level. And so I'm lucky to have such great partners in the work, because it really is challenging out there from both a health perspective, but also from the economic perspective.
Mr. Ball in Howard County.
Yeah, I just have to agree with County Executive Olszewski, working with County Executive Glassman and so many others on trying to flatten the curve and slow the spread has been challenging, but we've been working together. Just on a personal note, my wife is a nurse, and though she's been in administration for over a decade, she's back to wearing scrubs and working. And we have 2 kids in the school system, so the online work, there are times when we have 4 devices going with Zoom calls and meetings at the same time, and our little dog barking in the background. But we're pushing through just like every other family, and we're trying to work on getting things like enough PPE for our first line responders, ensuring that we're working with our hospital to have a surge plan should there be a surge, working on increasing our testing capability on the diagnostic side while evaluating the promise on the serology side, and so many other things to, as we're working through this global pandemic, see how we can make it so that not only physically, but also mentally and emotionally, our community knows that we're there for them.
Mr. Glassman up in Harford County.
Jeff, we've been fairly blessed in the region, I think. We've got about 532 cases up here in northern Harford County. About 21 folks have succumbed to the pandemic. We've lost them. Half of our deaths have occurred in nursing homes, assisted living facilities. So I feel like in the Baltimore region, we have been spared somewhat of the higher numbers. Some of that is just due to, I think, to population, not as much public transportation and the density of housing. We have really kept county government open probably from the first day in early March as we begun to implement our pandemic plan. And most of all our counties, working with Calvin Ball and Johnny Olszewski, we each drill, and we have emergency managers that have continuity of operations plans that we never think we're going to have to kind of put into action. And the one that we pulled out really went back to the SARS epidemic a number of years before our times, where the county had begun to develop a plan. We have plans for blizzards and those kind of natural disasters, and local government is adept at this, but this is a whole new kind of ball game for us. And we've been fortunate that the drilling and practicing this, we've been able to work with our Upper Chesapeake Hospital partners. Our testing is pretty well ramped up. We are able to test everyone either through our drive-up facility or through our private labs. Everyone that wants or needs a test through a script is able to get one in Harford County. And so we are beginning to come through that side. And I think our health department is beginning to beef up and think about the contact tracing that will come in the next phase of this as we begin a gradual reopening.
That's exactly where I was going to go for a follow-up is, do all of your county health departments that have to be overwhelmed? I mean, same idea. They think about this in theoretical terms for years, and then it hits and it hits big. How could they actually perform the number of follow-up calls and so forth to do the contact tracing to the level of detail, the degree that would be needed? Are you confident in that?
Well, I think, you know, I'm probably in a little better situation than my colleagues, Howard and Baltimore County, but many health departments are contractually going to have to work with partners to bring additional independent contractors or staff to do much of the second phase of this tracing and even some of the testing. I always point out as a former MACo president that our local health departments are operating on the same dollars, the same degree of funding as they were receiving in the 2008 recession. So it is our gargantuan task for our local health departments. And I must say, throughout the state, working with their health and hospital partners, our local health departments have really stepped up to provide and I think try to help us work through this pandemic.
Yeah, similar to County Executive Glassman, we also have been working on building up that capacity. And Howard County being able to partner with, for example, our school system, while we have schools doing digital and virtually, having our health officers there working with us. We actually are working to beef up our contact tracing. We've been expanding with certain epidemiologists who are helping, but as we have more testing, we're going to see more cases. As we know, and as we're learning, many people are asymptomatic. So here in Howard County, where we've been able to have about 575 tests already as of last week, and just yesterday, we had our record number of tests, almost 200, go through our vehicle admissions. We're going to see more people who are testing positive, more confirmed cases. And once we do have more access to the data as it relates to the FDA approved or authorized serology or antibody testing, we're going to see people who have had those antibodies, who may have just had the coronavirus or COVID-19 that we didn't know, and then start looking potentially at who they're touching base with. We're seeing, frankly, an increase in people who are familial in their relationship or have multifamily dwellings. And so we want to make sure that we're learning as we're evolving and making sure that we do implement the strategies that will help keep people safe.
Yeah, and I'll just add that, you know, County Executive Ball and Glassman are leading in their respective jurisdictions. I think we all know that we need the testing, the contact tracing, and the ability to quarantine and isolate. I think we're all ramping up. We now have the ability to test 5 days a week in Baltimore County. We've got sites all over our jurisdiction. And then, you know, I think this is also forcing us to think about how do we innovate? How do we do partnerships? I know County Executive Ball has really been thinking a lot about how do we get that antibody testing up and running. County Executive Glassman has been doing a really fantastic job. We partnered with our community college, CCBC, to actually stand up 2 weeks ago a contact trace program. We've had over 1,000 people already subscribe to that online free program where we are training people to actually step up and do that. They're anticipating over 100,000 of those positions needed nationwide. We have our school nurses from our school system doing that work now. We're planning to hire at least 60 more by July. Probably we'll need more than that, but it's really about building that infrastructure and innovating locally in partnership with the state. I want to commend Governor Hogan and his team for also working with us local jurisdictions to try to find solutions. But really every day at the local level, we're working with our health departments to figure out how do we innovate to sort of tackle this and get ahead of what's next.
Johnny, the CCBC thing, they're looking to hire now because, you know, we just saw the news today, you know, tens of millions of people out of work looking for jobs.
Yeah, so we're going to hire 60 from the program. It's certainly not the only credential, but it's an important step of learning how to do the work. We've gotten interest from other local jurisdictions into the program. We're trying to promote it. We know it's going to be needed across the country. And so as thousands and thousands of people are losing their jobs, this is actually a good contractual opportunity for people to both fight the disease and help their neighbors from a public health perspective, but also to fill the gaps in employment. So we're adjusting and shifting as we go along, and we expect to be hiring in just a few short weeks on that front.
So I'm sorry, CCBC is doing the training or the hiring?
They're doing the training. Baltimore County and our health department will be doing additional hiring.
Got it. You know, you know, I've been stuck at home for a while, and everybody's fine, which is great. Go out for a lot of walks. There's a big highway about a block away from my house, and you can just see over the past few weeks the traffic volume increasing. I mean, initially there was nothing. You barely had to look both ways before crossing the street, but it seems to be coming back. And I wonder if that's your sense of things, and whether that's something you're happy or unhappy to see, or are we reopening too slowly, too quickly? Maybe Mr. Ball first. How's it feel to you?
So there definitely has been quarantine fatigue. I think as you look at the data of transportation and people moving about, it's not just your anecdotal feel. The data do bear out that people are moving around a lot more. I am concerned, frankly. I think that while it's difficult and it's challenging, we need to maintain physical distancing. And I want to highlight physical distancing because I think now that many of us have been in this for several weeks, the social disconnection feels quite isolating, and it's difficult, especially as we're seeing the weather get a little bit better. But we need to ensure that we are meeting the metrics that not only the White House put forward, but Governor Hogan put forward in trying to keep people safe. Now, I am pleased that sometimes when I do go out, I do see people with the face masks, and I do see people trying to exercise that 6 feet. But this is not the time to relax too much. We need to remain vigilant. And frankly, during the 1918 pandemic, there was a sense of patriotism in stepping up and doing what you can for your family and your neighbors to help keep them safe too.
Barry?
Well, I tend to lean towards, you know, I think folks are beginning to get the urge to get out, and I kind of thought from early on, and most people believe that, you know, in a free society, Americans by their spirit are used to moving about, earning incomes, and not being restricted. So I think there is only a fixed amount of time that, you know, folks are going to sit home and stay without moving about, particularly with the weather warming. And I think the good thing is that many folks have adjusted to the social distancing, staying 6 foot apart, the hand washing, mask. And I think the new normal is that as we begin to open and interact, at least I think for the next 6 to 7 months, we're going to have to practice that no matter what. And that small businesses, when they open, restaurants, as we've seen in other states, we're going to have to adjust. I mean, you know, we're going to be further apart in restaurants, maybe outside. Small businesses are going to have plexiglass at the cashier and limit the number of folks that come in. So I think we're going to have to walk that fine line of practicing our freedoms, yet being safe and protecting workers and family members. But I do think we've come to that time where folks are going to be, as we used to say, that they'll vote with their feet, begin to walk out. And I think we're going to see folks begin to get out in their communities a little bit more. We've just got to continue to stress that they have to do it safely.
And Mr. Olszewski, that idea that there's a fine line, or are we on the line, or are we one way or the other? How do you see it?
Well, I see it as I am a huge extrovert, and this is hard, right? We know that this is really difficult for all of us to be staring at computer screens and to not be able to embrace our loved ones. And we all want to get back to that sense of normalcy and that sense of what we have known, the familiar. And I feel it. And so I know that this is really hard out there for individuals. I think that we know the underlying conditions that have to be in place for us to do anything safely. I think we're moving towards that. We're trying to make sure that science and the, the experts are informing those decisions. And it's the ramping up of testing, it's the contact tracing, it's providing the PPE, it's doing the supports at our small businesses so that there are the plexiglass shields, that we are putting in the distancing and the recommendations. It's about thinking about how do we use technology more intelligently, both with our business community, but also in government. We are lucky that we've had the infrastructure in place, and that we have now over 70% of our non-public safety workforce is working remotely. To County Executive Glassman's point, keeping government operations going. So we have to be thinking about, in government, how can we support local businesses and our residents to keep them safe, but also give them the supports to keep going, to get started back up, so that we can sort of follow that best advice and keep the curve bent so that we don't overwhelm our health systems, but we also do get back to that sense of normalcy that we are all yearning for so much these days.
How's everybody doing in terms of the protective equipment, the masks and so forth? You all have people working for you, first responders, other people who never thought they would be thought of as first responders. Are you able to get the stuff that they need? Second part of that, is there anybody in your county who's making it, at scale in factory type sizable numbers?
So in Howard County, had numerous donations, and we've been quite blessed in that respect. We currently have sufficient PPE for today. However, knowing that we don't know when the end of this pandemic is going to be, we continue to seek out those donations, to work, frankly, with some of our partners on the local level to try to have more work with some of the businesses in the region. We do have some of our businesses on every scale, some who are just repurposing their businesses from arts facilities, distilleries, to making some of that PPE or hand sanitizer. And we applaud them for stepping up and helping to fill that void, but we definitely need more. That is an example of some of the innovation that County Executive Olszewski talked about, or you talked about. We have even frankly launched a few different map apps where people can see how many restaurants are delivering. And right now we have 175 restaurants that are participating, 36 farms as we're going into our farmers market season have applied. So people can see how they can, as County Executive Glassman indicated, still get out and get the things that they need, but in new and innovative ways that help protect our society.
We're in good shape with PPEs right now. We've had several corporate sponsors really donate. We've been able to get a couple of purchases through, and we have some purchases still pending for face masks and other gowns and some of the things like that. We're trying to beef that up because we anticipate, as I indicated earlier, that for a good while, that's going to kind of be the way of life, that our first responders, our folks on the front lines are going to need PPE as they conduct their business into the fall. And we are following probably when we get to the regular flu season, unless we get a vaccine, I anticipate in the fall and winter, we're going to have another uptick. So we want to build up our inventory and supplies. So we're prepared as we reopen and move forward, that if we do get some hot spots or upticks, that we have that equipment. We're also making a concerted effort to make sure nursing homes, those facilities that right now we know are very high risk, that they have all the adequate protections that they need to kind of contain those virus outbreaks in those certain segments.
I don't know how much this is something that can be addressed on the county level, but the racial disparities in the data that we're seeing on coronavirus victims, about 31% of the state's African American. The percentage of people dying of this disease, 44% African American. There's obviously, there are national issues, statewide, global, but on a local health department basis, is there anything you can do to try to maybe pay additional attention to communities of color?
Yeah, I mean, I think it's about being data driven as best we can and providing our resources. I mean, in Baltimore County, we've started standing up our test centers around places that have been hardest hit. And unfortunately, this virus has, I think, sort of highlighted the underlying health disparities that exist out there for communities of color and lower income communities. And so we're looking at not just things like additional testing so that we can help inform people, but how do we put those social supports in place? You know, for example, it's harder for people who are lower income to find ways to quarantine, self-quarantine, and isolate, to do the contact tracing, to provide testing, to provide access to the PPE. I mean, to your earlier point, we did a tour of LifeBridge Health last week, who are actually, they turned their whole second floor into a PPE factory for not just their healthcare facility in Northwest Hospitals, but also all of the nursing homes with whom they have relationships. To County Executive Glassman's point, we have over 70% of our deaths have been tied to nursing homes, but also we're seeing those incredible spikes in the health disparities and African Americans dying at a disproportionate rate. So it's about how do we make sure that we step up locally and meet the needs where we can, even as we try to work with our state and federal partners to address the really significant underlying health disparities in these minority communities.
And we're finding that also in Howard County. In Howard County, we have about 20% of our population that are African American, but about 35% of the confirmed COVID-19 cases. And I think, as County Executive Olszewski indicated, there are those underlying health disparities. When we look at things like who has diabetes, who has obesity issues, these are some of the things, you know, when I look at hypertension, that frankly, if we begin to conquer some of those challenges, and sometimes it's just investing in more sidewalks so that people can walk safely and be exercising a little bit more, or making sure that people have access to healthier foods, ensuring that, especially in neighborhoods of color, there is that opportunity, improving transportation. All of these are the factors that not only improve a quality of life, but improve a quality of living and help people be healthier and more well so that they can all combat some of these challenges, whether it's the COVID-19 pandemic or whatever other challenge faces us and our society in the future. The stronger we are as a community, the stronger we'll be when we have to fight these unknown and unseen health challenges.
And I think one of our tasks too is what we've been doing is trying to get that message out that the COVID-19 is particularly devastating to our African American community, Hispanic folks that have underlying health, and many of our folks in that community are working so hard and so busy that they're not like everyone that watches cable news 24/7 and knows, in fact, that they may be at higher risk than someone down the street. So I think messaging to make sure we get out to that community. And maybe finally on a national level, at the healthcare level, we will begin to look at communities that have been discriminated against under our healthcare system with mental health, pre-existing conditions. There are a lot of communities that have not had the type of treatment or coverage over the last 2 decades that this is kind of bringing to light, that there's a lot of underlying medical conditions that have not been addressed in many of our communities, whether you're rural, poor, urban, or Hispanic, African American, across the spectrum. I think our healthcare system has failed to address a lot of that.
Let me, we've got about 4 or 5 minutes before I know you all have to get to the next event on your schedules, but I wanted to bring up schools. The governor has press conference this afternoon. The state superintendent's going to be there. Likely that they're going to throw in the towel on the rest of this school year. What do you want to see going forward if we have to continue with some sort of remote education in the fall?
Well, Jeff, we had a call with Senator Cardin in Harford County just yesterday to talk about this. I know in rural Harford County, we have a connectivity problem as far as broadband, and So no matter how many devices that we push out to school children in certain geographical areas of our county, they are not going to have that connectivity. So we urge Senator Cardin, when they look at this, maybe the next CARES version of stimulus that's going to come down, at providing some kind of infrastructure improvement that will get out into suburban rural areas. I know my friend Calvin has problems even in parts of Howard County, and Johnny O up in northern Baltimore County. There are still probably areas where you can only get Wi-Fi, and it's expensive and probably not fast enough to download an assignment. So to me, in our area, that's an area we've got to address if we think, in fact, that this into the fall, that our children are not going to make it back to school for the next year. But I also think schools are going to need to evaluate next fall, is every child going to need PPE? What degree of protections are we going to have to put into the school infrastructure to protect not only teachers, staff members, and students? So that's a big task, and it's May, but you know, September, August is not that far away for the next year.
I'll just echo Barry. He's absolutely right. I think we all share the concerns about internet access. Just like this virus has laid bare the health disparities, we've also seen some communities who just, even if they physically have access, they can't afford or otherwise can't get connected to. So there's both the actual existence of broadband and internet, but also the affordability and connectivity there. I hope that we see a plan not just for continuing education into the summer to extend that learning. I think there's been some weeks that we've lost as we've tried to stand up the infrastructure, but also, as County Executive Glassman said, a plan to both either continue into the fall through distance learning, or to ensure we have the safety and protection of our teachers. You know, I'm a former teacher, always sort of thinking through that lens for both our teachers and our students and our families alike as we think about how long this might go on.
And I share those concerns, and we do have those issues here in Howard County. And frankly, I have even more concerned about all of the children who only sometimes got their one meal in schools. I'm concerned about where we began, like I indicated in my family, where we might have 4 people having to work on different devices. There are some families that don't have access to that many devices, or as County Executives Olszewski and Glassman talked about, the bandwidth isn't that strong. I'm concerned about some of our kids who have IEPs, or our kids with disabilities who needed that classroom instruction and aren't necessarily online learners. And so there are numerous issues that, frankly, in this Teacher Appreciation Week, when many of our teachers didn't sign up for the pedagogy of distance and online learning and are stepping up and learning how to try to take care of their children and not just teach the ABCs and 1, 2, 3s, but foster a culture where our children can learn and grow in a way that they hadn't necessarily prepared for. I'm concerned about them, and I want to make sure that they have what they need to be successful.
And I think it's important,
Please.
at least for me, that for some children, and I probably was one of those type of children in school, there is no substitute, and some children need a teacher to be there to explain, to look them in the eyes and say, this is how you work through this problem. So, you know, I love technology, and I've learned to deal with it at 58 years of age, but I do think deep down believe there is no substitute for some young people than having a teacher in front of them, teaching them and showing them how to work through their assignments.
Gentlemen, I really want to thank you all for putting us on your calendar for a few minutes today. Before we go, if I can get the screen share thing right, I have one bit of this is personal lobbying. I got to show you a picture.
Okay.
And this is actually at a school that is pretty much in my backyard. I won't mention the county, but I don't know if you can see this basketball hoop that I've made a lot of free throws in. I've missed a lot, but it's really hard to get the ball to go through the hoop at the moment because there's a piece of wood going across the top and the bottom, and it looks like they're bolted together. The only good thing is it looks like the crew that did this work may have painted the backboard while they were at it. But I don't know if that image looks familiar to somebody. Hopefully before the summer's out, we'll be able to shoot some hoops.
Yeah, I'm hoping we get to phase 1 and get those opened up this within a week or so children and everybody can get out to play.
Gentlemen, stay safe. We really appreciate the time. Mr. Ball, our thoughts, with your wife and her colleagues at her job. And thanks again, everybody. We appreciate it.
Thank you.
Thanks. Be safe.
Stay safe.
Take care.